Good day. It's Mike, and welcome to Mike's Diabetes World. We're out and we're enjoying the warm weather. We'll see what it's like later today. It's already 28, 29. Today I want to discuss infections and why does it happen, especially if you're a brittle diabetic. Yeah, Lord knows, but we'll be right back. Okay, so today we are doing infections. Now, infections, which is trachoma, you want to make sure you keep yourself clean, dry, because any sort of dirt or any sort of thing can get in and cause an infection. I had my nephew run over my foot and it got infected. So it can happen anyway. And why does it always seem to happen with type 1 diabetics? Well, it's simple. It's your sugar in your blood. Ideally, you want to keep your blood sugars stable. But that doesn't mean you're cured from it. But your body has more to fight back with. And infections are not great fun. You have a chance to lose a limb. I know, basically, I've had a number of infections, and my legs or whatever has never been in danger of being lost. However, it could have very easily turned out that way. So, if you have a cut and it's starting to look red, first thing you should do is make sure it's clean. Make sure it's dry and dressed. A lot of people right away put on some Polysporin, but you don't want to be using antibiotic ointment all the time because we're getting super bugs out there right now. But just a little, and that will usually stop the infection. But on the days that isn't stopping the infection, well, then you have problems. And what can we do? Well, the first thing that you notice that you have an infection is get help. Don't sort of sit there and say, oh, well, it's infected. Oh, well. Oh, ow, it hurts. Don't be stupid. Get medical attention. Make an appointment. If people leave it, or it can work very quickly, and you'll want to go to a hospital. But don't let it get that way. Begin is if you have a cut, dress it, put a little dab of antibiotic ointment on, and if it's a couple or in an hour or a couple of hours, if it's starting to look really angry, make an appointment to see the doctor. Personally, if I get anything infected, it goes quickly. My leg will be red, and then if it starts being red, I'll make an appointment at my GP. If it's red and sore and spreading quickly, I'll head to my local hospital. There, I put on an IV drip and told to come back at about for 4 or 5 days, a week maybe. I will have to go back, get treatments, and then I could go on to oral antibiotics. But like I mentioned before, you don't want to do this all the time. So you need to be careful. Don't cut yourselves with a packing knife but if you do get injured, get it taken care of. I'd hate to say don't leave it to the last moment, because that should be common sense. But a lot of guys feel, oh well, I'll be tough. I won't go. And a lot of women, oh well, I'm just too busy. Or vice versa, you never know. But don't be idiotic. There was one time I had gone into emergency and had an infection and had to start IV antibiotics. And there was a gentleman who came in, and his leg was absolutely huge, hot, and red. And for years, I always thought, oh well, he's lost it. But amazing, they were able to save the leg. He's got some scarring, but the leg went down quite well. So, but don't sort of say, oh well, see, that worked fine. I don't need to worry about it. Well, you do. Because your sugar is just going to keep driving the infection. Now, what's the signs? Well, if your site is red, and the redder, the worse it is. It's going to be sensitive to the touch, usually. And then it's going to be radiating heat, because your body is trying to fight, and it's sending white blood cells, couldn't think of the word of them, to the site. So it can be very traumatic. It can be very sore. But take care of things. And don't sort of sit there and say, well, the doctor says I have to stay off my foot. I can't go to work. Oh, woe is me. Well, would it be better to not go to work for a couple of days or a week or so than having to stay off work permanently or losing a leg and not being able to do the job. But the male ego is fragile, and it's a lot of times a lot of people, or a lot of guys, will just fight it off. I know the symbols, and I know I've seen many diabetics who have lost a foot. Now, the problem being a type 1 is that you would, a lot of times, just get an infection, and then you can't control your blood sugar, whatever. You could try to the best of it, but you just can't do it. So you now got to get treatment, and once you get it under control, your blood sugars will come back down. Your body, when there is an infection or when you're ill, can be its own worst enemy. So be sensible. Take the time, take care of yourself. Now, a lot of people pretty well know what I'm talking about. You know, if you're having an infection, treat it. If you're a lot more than what am I saying? There's another feature that you need to take care of, not feature, but something else you need to do. And that is hydrate yourself. And kind of like on a hot day, like today is here, if you find yourself with an infection, you're going to want to make sure you're hydrated. And the doctor said to me once, well, hydrate yourself, and when you think you've had enough, keep hydrating. But I've had others kind of say there's a little kind of a clue, and that is if you are peeing clear, then you're hydrated enough. Well, that's more for hot weather, but you want to make sure your body is working at the best homeostasis it can. Now, how to stop? Well, I talked a little bit of, not precaution, but if you get anything, treat it, get it treated. I worked in an industry at one time that there was myself and another diabetic who was working there, and he would always go and, you know, if he bruised his leg or cut himself, he would go and to the first aid and get it looked at. Well, I don't know if it needs to be that extreme, but if you cut yourself, go to first aid and make sure that if you injure it at work, that you report it to your supervisor or whatever, and make sure that they form a file. Now, people say, well, it's only if I really need time off, like, come on. Well, no, it's not. it's really there that if something happens to it. So if you are a diabetic and something happens to it and you injured it on the job, make sure you're covered. I know that's, just make a clarification. That's sort of the rules here in British Columbia. Now, any little nick or cut can become infected. You can very easily get a lung infection, and I don't know if we really become stupid when we have an infection. It's kind of like, oh, well, I don't really need to go see the doctor. I've got to keep working. And even when they go into the hospital, they're still acting like a bunch of morons. If you have diabetes, always lean on the side of caution. I've been at cub camps where I got sick, and at that time I did a stupid thing. Oh no, I'm camp chief, I have to stay here. Well, I went home sicker than a dog and ended up in the hospital. Well, if that's the sort of thing, I guess if you're a person that craves attention, well, you can go in there. And I think was it yesterday? I mentioned about, I kidded my, I guess you can call her diabetic nurse or nurse practitioner, about going to being sent to the hospital because I had the flu and I was throwing up. And I ended up being 6 months in there. I don't know, when I get an infection, my body goes totally berserk. So my blood sugars go up, and if you don't sort of treat that your blood sugars, then you're going to end up in DKA. And then if you end up in DKA, you're going to be sicker. And you're going to end up in the hospital for sure. Well, if anything goes red and beginnings to start swell, if you have things like crutches, if it's on your leg or your foot, then use the crutches. Immobilize it. Use splints if you have to. Well, that's more broken, but sling if you have to. But do what you need and get out there, get the help you need, and recover quicker. Have a great day, and we'll talk to you later. Bye now.